A presentation of Episurf Medical's next product for focal cartilage lesions situated in the patellofemoral joint, the patient-specific Episealer knee trochlea, the next step in orthopedic medical technology. Every year there is an increasing number of knee joints with symptomatic chondral damages, which leads to arthrosis. The disease progression is slow, but it ends in a situation where the knee function deteriorates so much that taking action becomes necessary. It has been shown that current available methods have failed to achieve satisfactory, long-lasting results. Knee joint replacement methods are costly, invasive, and require a complicated, time-consuming rehabilitation program. Further, biological methods of various kinds are particularly insufficient in the patellofemoral joint. The unique and patient-specific Episealer knee trochlea has been developed to manage early localized cartilage lesions in the patellofemoral joint of the knee. The trochlea area of the knee has a high level of geometrical variability, not only between such factors as gender, but between each individual. An individualized Episurf implant is designed based on patient-specific computer images obtained by a magnetic resonance camera. This means that the implant's shape and surface is customized to each patient's knee anatomy, and, independent of the cartilage lesion location, size and depth, a smooth and continuous joint surface can be recreated. Surgical guides have been developed to insert the Episealer implant at exactly the right angle and depth. The surgical guides are designed using the patient-specific magnet camera images via the same process as the implant. The surgical guides become uniquely fitted to the knee's anatomy and can be positioned in the knee joint to fit over the damaged area. The guide assists the surgeon through the surgical procedure, enabling a simpler, more precise and reproducible procedure. The Episealer knee is positioned to replace only the damaged cartilage and is inserted at the right depth and angle in relation to surrounding cartilage. Implantation must not always be symmetrical in the trochlear groove, but can be angled either medially or laterally, depending on the location of the lesion. The implant is now firmly inserted and sealed to the bone tissue beneath. The position and topography are perfect fits to the surrounding cartilage and provides an optimal surface for the patella to once again slide over the trochlea area. The bone anchoring part of the implant is double coated with bioactive hydroxyapatite onto a layer of titanium, which stimulates a rapid osseointegration, which safeguards a long-lived bone anchorage. The advantages of the Episealer are evident. An implant specifically designed for the patient's own unique anatomy, using a high-level engineered surgical technique with a well-sought-after precision, making the implant as unique as the patient. Episealer and EpiGuide from Episurf Medical.